Every 2 minutes, somewhere in the world, a woman dies from cervical cancer. But here's the thing, cervical cancer is one of the most preventable cancers in existence. We have the tools, we have the tests, we've had them for decades. And yet, millions of women either don't get screened at all, or they get screened without truly understanding what they're being tested for. So let me ask you something. Do you know the difference between an HPV test and a Pap smear? Because they are not the same thing. They don't test for the same thing, they're not recommended at the same age, and getting one doesn't mean you don't need the other. By the end of this video, you will know exactly which test you need, at what age, how often, and what your results actually mean. Let's get into it. The Pap smear, also called a Pap test or cervical smear, was developed in the 1940s by Dr. George Papanicolaou, and it quite literally changed medicine. So what does it do? A Pap smear collects cells from your cervix, the lower end of the uterus that connects to the vagina, and examines them under a microscope to look for abnormal cell changes. Here's the key word: abnormal cells. A Pap smear does not directly detect the HPV virus. It looks at what HPV or other factors may have done to the cells of your cervix. How is it performed? During a routine pelvic exam, a healthcare provider uses a small brush and a spatula to gently collect cells from the surface of the cervix. The sample is sent to a lab, where a cytologist analyzes the cells. It takes only a few minutes. It may feel slightly uncomfortable, but it should not be painful. What does it detect? Normal cells, no action needed. Ascus, atypical squamous cells of undetermined significance, borderline changes, low-grade abnormalities, LSIL, early changes that often resolve on their own, high-grade abnormalities, HSIL, more serious changes that need follow-up, carcinoma, cancerous cells. Think of the Pap smear as a snapshot of your cervical cells at a given moment. Now let's talk about the HPV test, and this is where many people get confused. HPV stands for human papillomavirus. It is the most common sexually transmitted infection in the world. In fact, most sexually active people will have HPV at some point in their lives, and the majority never even know it because the immune system clears it on its own. But certain high-risk strains of HPV, specifically types 16 and 18, are directly responsible for about 70% of all cervical cancers. So what does the HPV test do? The HPV test detects the presence of the virus itself, specifically those high-risk strains, in the cells of your cervix. How is it performed? The collection method is almost identical to a Pap smear. In fact, both samples can be collected at the same time from the same swab. The difference is in the laboratory analysis. The HPV test uses molecular techniques like PCR to look for viral DNA. What does it detect? HPV negative, no high-risk virus detected. HPV positive for high-risk strains, you carry a strain that could lead to cell changes over time. HPV 16/18 positive, highest risk strains, requires immediate follow-up. Here's the critical point. HPV positive does not mean you have cancer. It means your body is currently carrying a virus that, if it persists, increases your risk of developing abnormal cells. Think of the HPV test as a warning system. It catches the risk before damage even begins. In recent years, medical guidelines have introduced the concept of co-testing, doing both a Pap smear and an HPV test at the same time. Why would you do both? Because together they create a much more complete picture of your cervical health. A Pap smear can be normal even when HPV is present, because the virus hasn't caused cell changes yet. An HPV test can be negative even when mildly abnormal cells exist from a non-HPV cause. When both tests are done together, co-testing, the combination catches significantly more cases that either test alone would miss. Current guidance generally recommends ages 25 to 65, co-testing every 5 years is preferred, or HPV testing alone every 5 years, or Pap smear alone every 3 years. Your doctor will advise which protocol applies to you based on your personal health history, country of residence, and risk factors. The bottom line, co-testing is considered the gold standard by many gynecological health organizations for women aged 30 and above. Let's walk through the age-based screening guidelines that most major health organizations follow. Age 21 to 24, Pap Smear only, every 3 years. HPV testing is generally not recommended at this age. Why? Because HPV is very common in young people, and the immune system usually clears it on its own. Testing could lead to unnecessary anxiety and procedures. Age 25 to 29, Pap Smear every 3 years. Some guidelines now allow HPV testing alone starting at 25. Discuss with your provider what's best for you. Age 30 to 64, this is the sweet spot for co-testing. Co-test every 5 years, this is the preferred method, or Pap Smear alone every 3 years, or HPV testing alone every 5 years. Age 65 and above, screening can often be stopped if you've had adequate prior screening with normal results. Women with no history of abnormal results or HPV may be able to discontinue screening, but only after discussion with a physician. Special circumstances. If you've had a hysterectomy that removed your cervix for non-cancerous reasons, you may not need screening at all. If you're immunocompromised, for example, HIV positive, more frequent screening is typically recommended. If you've been vaccinated against HPV, you still need regular screening. Vaccination does not eliminate the need for testing.